Hi everyone, welcome back. Today I'm joined by Dr. Philip Deibel, a longevity medicine practitioner and the founder of D5 Health. Hi Dr. Philip, how are you?
I'm doing great. Thanks so much for having me.
Thank you for joining me. So today we are going to talk about peptides, and I like to start with GLP-1s and retatrutide because it's like there's so much noise around it, and I know like a lot of our audience wants to know more information about that. Can you first of all, so we know that it was before more about Ozempic, Mounjaro, and now with the new peptide, retatrutide,
hmm
it's gonna change a little bit. Can you tell me a little bit of the difference between uh, GLP-1 only, like Ozempic, with retatrutide?
Sure. Yeah, it's certainly been a fast-moving topic over the last several years. And I do have a bit of a love-hate relationship with GLP-1s. I love their potential. I love the possibilities there, but especially in America, I sort of hate how they're being
Mm,
used. So, these
mm,
drugs were primarily diabetic drugs, and they noticed the rapid weight loss. And so that's kind of how it's taken off since then. The second generation, the single agent, the Ozempic, the Wegovy's, the GLP-1 only medications were kind of game changers for weight loss. And then tirzepatide, also known as Zepbound or Mounjaro, came along and added the GIP component and showed even greater weight loss. And now, as you mentioned, retatrutide, which is still in clinical trials, phase three trials, is adding on a glucagon agonist. So it's a triple agonist medication. And people are losing a lot of weight, right? But people also, especially in America, they want a quick fix. So they're using these. They're not eating. They're wasting away. They're losing weight. But they're losing a lot of muscle. And eventually, whether it's the expense, which is a whole nother conversation around the cost of these drugs in America, or side effects, they're stopping it. And they're gaining probably 80% of the weight back, but they're not gaining the muscle back that they lost, and they're worse off than they started. Or they have side effects from these high doses, gastroparesis, constipation, gallbladder
mhm,
problems, pancreatitis. So it really needs to be done correctly under guidance with supportive measures, exercise. You have to move, you have to lift weights, you have to use your muscles, nutrition, getting
exactly.
good protein intake. I have everyone on creatine to help support the muscles. And so in my hands, when I approach it, and we can get into this if you want, is I really start really low and go very slow,
Mm-hmm.
just enough to create sustainable change for patients. I like them to lose at most 1 to 2 pounds of weight per week, about a pound a week for females, and
Mm-hmm.
maybe up to two for males. And I think at that pace, you minimize the muscle loss that can happen with the medications. I am watching
Mm-hmm.
retatrutide. I think we'll get into this a little bit, but it's still in clinical trials, and so it is being compounded through some pharmacies, but also just online that people are buying. The gym bros love it, and they are touting that it can protect muscle a little bit more. I don't think that's quite panning out in the trials, but it does increase your sort of baseline thermogenesis. So you do burn more
Mm-hmm.
calories kind of at rest on retatrutide, so you will
Mm-hmm.
lose more weight. But how quickly does one really need to lose weight? If you can lose 23% of your body weight, do you need to lose 27%? Like, do you need to lose it faster? So I'm more
Mm-hmm.
of a wait and see approach. I'm going to wait till the trials are done, till it can legally and safely be compounded by FDA registered and local, board of compounding monitored pharmacies before I start using it in my patients.
Mm-hmm. Okay, so you don't recommend it at the moment because, like, I see publicly people, especially influencer, they are using that, and it's like some of my friends also like using that and recommend to each other. And
Sure.
I know how to approach to prescribing Ozempic, but it's about Reta is a little bit like as you said, like it's still in the clinical trial, but I know there are huge demand for that. So I mean, I
Mhm.
think it's better to people um, ask about like the clinician instead of like influencer. But I know there are some patients and some people, if I don't help them, they would get a help from like online sources. They would ask the ChatGPT. So this is the reason
Sure.
like to educate myself around this topic. And I know you have much more experience than me. And I want to ask about the side effects, about the longer term user of the GLP-1s. This is the topic I'm really interested in because I see so much demands around it, and people, they are all losing weight. And like, it's so funny. The last time that I went back to my country, all the people that I knew, they got skinny. I was like, what is happening here? Like, it's just like everyone are using that. And right, it's good. I saw people that they are struggling with weight and around this topic, and I'm happy there is a tool that can help them. But at the same time, as you said, the amount of usage is not necessary for everyone. And I'm really curious, is so if a patient comes to you and wants to have a GLP-1 or retatrutide, how would you prescribe or how would you approach that patient?
Sure. Well, I think it's good to have a good, thorough physical and history, right? You want to understand what their goals are. I do a body composition scan for all of my patients, and I trend that quarterly.
Mhm,
For some patients that are
mhm,
losing weight more
mhm,
rapidly, I'll do those monthly. So I always get a DEXA scan once a year, which is the
mhm,
gold standard body composition analysis. And then it might be a couple percent off based off my in-body device in my office, but I'll use that to trend just to make sure they're not losing weight too quickly, make
mhm,
sure they're maintaining their muscle mass. But understanding their goals, their history, what are they doing to try to lose weight, right? Do they feel stuck? Are they already doing all
mhm,
the right things and the scale is moving in the wrong direction? Do I need to do other testing, whether it's traditional testing or functional testing, to figure out, is there a reason they're not improving? Um, but for
mhm,
most people can benefit at least from a microdose of a GLP-1. So this is a topic that I've been following a lot over the last year, and I'll bet I'm recommending it to 60 to 80% of my patients. I personally microdose
exactly.
tirzepatide. I take 1.5 milligrams per week. I'm only trying to gain muscle, so this is not about losing weight. This is about having the anti-inflammatory benefits, having the blood sugar
Mhm,
control benefits, quieting the food noise so
mhm,
I can make better decisions versus acting based off cravings. So I have patients that may want to lose 5 or 10
mhm,
stubborn pounds, or maybe they are a smoker or they're drinking too much. It's kind of amazing how a microdose can affect that reward pathway, that dopamine pathway. And so people are coming back,
exactly.
right? People are coming back saying, my joints feel better. I feel like I'm less swollen, even before there's any appetite suppression at the level. Or I'm drinking less, or the food noise is quieted. That's the big thing. People say, wow, that internal monologue or dialogue of what should I eat? Should I eat that cookie? Should I not eat that cookie? That food noise is turned way
Mhm,
down. And so they're able to make those conscious,
exactly.
choices. Um, and then we go up slowly. So I may start them on 1 or 1.5 milligrams. And then lately, my primary protocol is to go up by zero point 0.5 milligrams every 2 to 4 weeks. So really slow compared to big pharma's doses of 2.5 in a month, go to 5, in a month, go to 10,
Mhm,
and then 15. And so people are losing weight, more methodically than just going out to dinner, sitting there and staring at their plate and then leaving. That's just not a healthy way to do it. I primarily use tirzepatide at this time. Um, I think that's
mhm,
as strong as I need it to be. And until there's some more real, I'm an early adopter. Don't get me wrong. I'm an early adopter of things, right? I've been working with peptides personally with my wellness doctor for probably 6 or 7 years now. But still, with something still in clinical trials, if something goes wrong with the patient, right? If there's a side effect and
Mm-hmm.
I have no leg to stand on. There is not a lawyer out there or a judge out there that would not say you did something wrong. So I'm just not willing to risk my license at this point for a medication that's still in clinical trials.
I agree. I agree. That's true. What about the other peptides? What are the other peptides that you're a big fan or you are practicing in your clinical approach?
Yeah. So it's tempting. There's probably 30 to 50 peptides available to me. I have compounding pharmacy accounts, probably 6 of them, so I can, depending on access and cost, and I can find what I need to. It's tempting just to use them all because there's a peptide for every symptom, every organ system out there. But my approach has been to really understand a core group of peptides. Get really comfortable using peptides, and then
Mhm.
add one here and there and slowly learn that one. And what you'll find, and you may know this even personally, but for most
Mhm.
longevity providers, we are kind of early adopters, but we're also kind of our own guinea pigs, right? I mean, I'm certainly going to try a peptide myself for a while, right? Before I recommend it to somebody. And so that's been the benefit of working with my
Yeah,
doctor for
true.
years. I've tried them all, and some have benefits, some don't, and that's my personal experience. Um, but coming back to your question, the ones I primarily focus on growth hormone releasing hormone, so GHRH or GHRP peptides, and recovery peptides. Those are the big 2 categories of
Mhm.
ones that I think there's a lot of benefit for. So
Mhm.
in the GHRH space, the primary ones I use, depending on the patient, the gender, their goals, are sermorelin, CJC/ipamorelin, and tesamorelin,
Mhm.
right? So those are growth hormone
Mhm.
releasing hormone peptides. The IPA is a GHRP, and based off their goals, the side effect profile, costs, kind of using all those taken together, we kind of decide which one to use. And I found tremendous
Mhm.
benefit for patients, especially if they're losing weight and the goal is to preserve that muscle, and they're exercising,
Mhm.
they're lifting weight, but they're at a calorie deficit because they're trying to lose weight. These GHRHs can be really helpful to help support muscle preservation and muscle growth. Otherwise, it's really hard to not only maintain, let alone build muscle while you're losing weight. Um,
So you saw like a difference between people that, like for example, if they are on GLP-1s and they're taking these peptides for protecting their muscle mass.
that's right. Yeah. I think if someone came to me and said, I try not to overwhelm people with recommendations. So we may start slow and implement things along the way. But if someone comes to me and says, Doc, what are you taking? Or what would you recommend if you could design the perfect thing? Then yeah, right now I really like the microdosing GLP-1s, low dose if they really need to. And then I'm a big fan of the tesamorelin. There are newer formulations pairing that with ipamorelin, which I think is very interesting. But tesamorelin, one of the
Mhm.
benefits is it's an FDA approved peptide. And there aren't many of those,
Mhm.
right? And it's FDA approved for
Mhm.
lipodystrophy in HIV patients. So it really targets visceral fat, right? Belly fat. Um, and so we're using it off label, but it's still an FDA approved peptide, which is nice to be able to say. And really dramatic body recomp changes.
Mhm.
So lowering body fat, improving muscle mass.
So you mentioned the microdosing. I wanted to ask, is there anyone that you say definitely cannot benefit from microdosing? Like, is there anyone, like any contradiction for prescribing the GLP-1 microdosing?
Yeah, there are a few people. There are some people if they have history of pancreatitis, or I had one patient that couldn't tolerate even a milligram, and she did not have a gallbladder, probably had some pancreatic insufficiency, and she had a lot of discomfort from that. Um, the history of multiple endocrine neoplasia syndrome was an issue. That's largely disproven. That's primarily in mice model, but certainly I would be concerned if a patient had that history.
So as a longevity practitioner, I want to ask you about how would you navigate longevity in your daily life? Because people always ask me like, what is special about the longevity? What do you do like daily? What do you recommend us? People wants to know. If you want to tell audience like 5 top priority that they need to navigate in their daily life for the longevity, what would you say?
Yeah, great question. And I think the heavy lifters, the biggest levers to pull, are probably a little disappointing to people because they want us to talk about the exciting supplements, the medications, the supplements, the things you can do. But I think getting back to the basics is so important. I spend a lot of time, my consults are at least an hour, hour and a half. And yes, we talk about peptides and hormones and all the fun things, but we get back to the basics of what was life like when we all lived outside? When do you get sunlight in your eyes? When do you keep it out of your eyes at night? So I talk a lot about circadian rhythm biology. And so that's where I
Okay.
start. It's how do they sleep? I have a walk me through their day. When do they wake? When do they eat? So I think a consistent bedtime, so going to bed within 30 minutes and waking up within 30 minutes at the same time every day is hugely important, especially the wake time, right? This allows your body to really drop
Exactly.
into the sleep cycles efficiently. And so if you have wearables, I love wearables, I love data, right? So you can track this, how efficient your sleep is. But your body, it wants to know what the routine is. So having a consistent
Mhm.
wind down routine, having the bedroom dark, cold, keeping blue
Oh,
light out of your eyes at night. I'm big on this. I wear red tinted glasses when the sun goes down to prevent blue light from getting in my eyes, right? Um, no scrolling,
interesting.
minimal screen time, very kind of consistent routine winding down for bed. And then in the morning, if it's dark when I wake
Mhm.
up, I turn on a light box, a 10,000 lux light box, to simulate the sunlight, which helps me wake up and also sets my circadian rhythm for the day, which makes it easier to go to sleep at night. Okay, so I talk to everyone
Mhm.
about all that kind of stuff. Um, Getting regular movement, right? So I tell people a
Mhm.
minimum of 7,000 steps a day, ideally 10, but you can get a lot of the benefits from 7, broken up throughout the day. So I have a standing desk, I have a walking treadmill, I try to take periodic breaks at least every couple of hours. So getting that steps in, because being sedentary is the new smoking. I think Huberman said that, but
Yeah.
I truly believe it. Um, Exercise, like, you have to use your muscles. You have to exercise. And I think it's shifted from having people eat less and do more cardio. I think now people realize, like,
Mhm.
okay, it's you should, food is medicine. You should fuel your body, and you need to lift heavy things. And so I think that's pretty non-negotiable.
Yeah.
Is and science has helped us really dial in exactly how much zone 2 cardio and how much strength training, how much HIIT training. So we kind of go through all of that. Um, Nutrition, eat the outside aisles of the grocery store, whole foods. Food is medicine. So I'm less about specific macros and real like meal planning. It's more, I talk about intuitive
Mhm.
eating, of just eat real foods that don't need labels. Prioritize protein, prioritize fiber, eat the rainbow, things like that. Um, and then stress management and social connections, I think, kind of go hand in hand. Uh, but our nervous systems are dysregulated these
Yeah.
days, right? People are stressed. People are in constant fight or flight. So I spend a lot of time talking about breath work and meditation, lowering those cortisol levels, which is social connections is so powerful. And so being around not just your
Mhm.
family, but good friends, sometimes it takes a concerted effort to do so. And I think that's a big push coming up for wellness. I'm very big in all the
Mhm.
advanced diagnostics and testing, but I'm excited to build sort of community longevity or community wellness centers. I think that's really missing. People are drinking less, they want to exercise, but it can be isolating, right? And the gym
Exactly.
is great, right? But so I'm really excited to kind of merge the social wellness space with kind of longevity medicine. I think that's kind of the future.
That's amazing. And I love that how uh, practitioners, they are joining community and they are treating and practicing medicine differently, not just like waiting for people to get sick and prescribe a medication and then just like having 15 minutes appointment and let them go. This is the way I love to practice medicine as well, like this holistic approach, and just as you said, like do the basic first. And
Hmm.
like food is medicine, the movement, get the light, you know, that for women working with their cycle, working with their biology and all this stuff. I'm so interested. Thank you for sharing that. And I hope so, like we as general like and practitioner and doctors around the world just connect with each other and like trying to build a community either online or either in our places. So as you know, like I'm at the moment in Bali. Here is just huge in health and wellness, so we have like different wellness clubs here. People are like, as you said, they are less interested in drinking. Like here it's just like no one smokes, no one drinks, and everyone going to gym the whole day, and they want to have this kind of community. So I'm kind of like deciding to go to the next location, but I'm like scared. I'm like, city life is not like that. Like how, people cannot do that, you know. It's just like it can be so isolating. I can imagine like how isolating it can be if you tell your friends I'm not drinking and I'm not interested like going out late, you know. I have my routine and stuff, and at the same time the social connection is important. So some part of like being healthy is just having some routines which can makes you isolated, and at the same time you need that social connection. So it was some point in my life also a personal um, challenge for me, like how I can navigate that, being around people that they are like-minded and they have like same goal with you and like same routines with you, and they're interested in the things that you are interested as well. So I'm a big fan of also like having this kind of community, and I think like we as doctors, the more we are present in the social media, the more we share about this stuff, the better and more accurate information people can have. And I think it's great, like as long as it's as we were talking, is kind of a full-time job, like creating content or this kind of interview. But I think it's very important for us to be more active on social media and talk more, because other than that, people would get information from the places which are not very
Exactly
very
right.
accurate.
Well, very well
Um,
said.
yeah. And I can see it here so much. Like you have no idea. It's where you're not in an academic space, you can see like how easily people are taking everything, just like not thinking about any side effect. And yeah, it's very interesting. I'm learning about human behaviors so much and how I can
Sure.
deal with challenge. It's very interesting, but at the same time, me as a medical doctor and experiencing practice in different places, it's just sometimes I don't know how to navigate that and
Yeah.
telling people that they are wrong.
Right. I think we, yeah, like you said, I think we need to adapt with the times. And where are people getting their information?
Yeah.
It's online. I think coming out of COVID, people have really taken their care into their own hands. There's a bit of mistrust with the system, and the system is
Mhm.
great for sick care, right? It saves lives, but it's not great for well care. It's a volume game. Doctors don't have time to talk about nutrition and exercise and all of the things. And now with the rise of wearable data and AI, and you could order your own labs, and people are taking their health into their own hands. And so I think the doctors are not going to be replaced by AI. They shouldn't. But doctors that don't use AI or don't embrace how to reach patients more, they're going to be passed over, right? So I think us, it
Yeah.
changing with the times is we have to be progressive as doctors. You know, things are changing. They're
Mhm.
changing fast. Every 6 months, things seem different.
Exactly. Yeah, that's so true. So how do you see the longevity medicine would go?
I think the potential is there, right? I mean, I think we're in a generation where our kids, and this is when I teach someone how to lead a healthy life, when I put these practices in place, when we go through their house and remove toxins, and so they can set a good example for their
Mhm.
kids, then the kids are going to change. Like my kids already think Coca-Cola is diabetes in a bottle, right? And they're
Oh, that's
my 12-year-old puts protein powder in everything, and then I'm finding my 10-year-old downstairs, you know, lifting light weights. And so I think are in an epigenetic slump, right? I talk a lot about
mm,
epigenetics, and that's how sort of ancestral memory can happen, how generational health can be affected. And I think we're in a several
mhm.
generation downturn, and we need to correct that. You know, our health dictates our
Mhm.
grandchildren's health, right? And there are studies that have shown this. And so I think our if we the faster we can improve generation by generation, we'll live longer and longer. And yes, there's talk about escape velocity. You know, will technology and will advances progress fast enough to one day we can reverse aging faster than we're aging? And yes, I think that's possible. Um, I think my goal initially is make sure I live to 100. But if I live to 110, 120, I wouldn't be surprised. But I really wouldn't be surprised for my kids. You know, I think that's going to be increasingly uh, possible, which raises a whole nother set of concerns of an aging population, how, you know, government programs are structured, how the workforce will change, how we view our second half of
Yeah,
our life. When do you retire? Like, there's just so many conceptually like exciting but confusing
yeah.
things that
We were
comes from
never
that.
ready for that, for that long.
No, right? I know,
Everything would
right?
change.
Right.
Okay. As a longevity practitioner, what are the supplements that you think most of the people would benefit from? Or you
Yeah.
approach it very personalized?
I do approach it very personalized, but I think there are a number that almost everyone can benefit from, right? There is very
I do
common
agree, yeah.
deficiencies, right? Um, I think magnesium is one that I think basically everyone should be taking at night,
Mhm.
very calming for the nervous system. Um, there's, there's a couple,
Magnesium glycinate, right?
that's right. Yeah. I like magnesium threonate for some people, but glycinate is the one I'm using for most people and I take. Yes.
Mhm.
Vitamin D, you know, I find everyone is not only
Mhm.
vitamin D deficient, but suboptimal. So LabCorp says 30 and above is
Mhm.
normal, but I want everyone 50 to 70.
Mhm.
Um, Fish oil is a common one, and creatine.
Mhm.
I think those are four that are somewhat staples that I could recommend to people.
Mhm. Do you recommend creatine to even to the people that you're not lifting weights?
I do. I do. And I
Okay.
think 5 grams is a starting point. And for people that tolerate
Wonderful.
it, I think we go up to
Mhm.
10. I think there's biological plausibility that it can
Um,
improve, you know, brain health. That research is newer, but I
ex-
don't see the downside unless someone has some GI distress. So work up to 10 grams.
exactly. Yeah, I do recommend the same. I agree. Um, What's your take on multivitamin? I have some mixed feeling about that recently, uh, about like B vitamins, B complex multivitamins. Some of my patients they show reactions in the skin for
Hmm.
acne. Some of them they report increase in cravings and the appetite.
Mm.
I'm sometimes I'm not sure if I should prescribe it to people that they are on a little bit of deficiency.
Hmm.
So normally I would do that. So if you are on any kind of restrictive diet, or for example you are low carbs, or you're not getting grains or gluten in your diet. And sometimes they are worried about, or I notice like some hair fall, and just like we want to prevent that, to be sure that you're getting enough nutrient in your day. So I would, like, for people that they are in any kind of diets, I would prescribe a multivitamin. But I'm not sure that is it necessary or not, especially for people that they are on GLP-1. So they would be on a kind of restriction, right?
Yeah, no, great question. I've changed my tune on this a little bit. I used to routinely kind
Mm-hmm.
of recommend a high quality multivitamin, and now I kind of go more targeted on the supplements based off labs. But on a population level, based off our food
Mm-hmm.
quality, our soil quality, people's general eating habits, there has been shown to be benefit of taking a multivitamin. But on someone who
Mm-hmm.
is doing all the right things, I think it's very reasonable to go for a targeted approach. There's a
Mm-hmm.
great lecture by Dr. Elizabeth Yerth at a conference a few weeks ago, and she said, in terms of supplements, you can give the body a suggestion or you can give it a signal. And I think multivitamins give
Mm-hmm.
suggestions because I don't like big blends that have underdosed but lots of different supplements because I think you're not quite getting the benefit of each one. So I do like individualized, properly dosed, good brands, certified supplements, not just whatever's cheapest on Amazon, right? Because I think that's dangerous to just take the cheapest one. You never know what's going to be in there.
Mm-hmm.
So it's a good question, but these days I do favor more of a targeted supplement approach.
Yeah, same, same. I do agree completely. So is there anything else around longevity topics that you want to mention to the audience?
Um, yeah, I mean, I think in general, I think we touched on a lot of what I wanted to cover. But I think if people can feel overwhelmed by longevity, and when I phrase it,
Mhm,
like the goal is to slow the pace of aging, um, people want quick fixes. And a lot of this stuff is
mhm,
basic. Supplements should be supplemental. And I think getting back to the basics is super important. Um,
so-
so I think I listed all the things that I prioritize. But the fun things are expanding rapidly. Things I'm excited about therapeutic plasma exchange, right? The world of toxins and microplastics and ability to filter blood. I'm watching that closely. It's still a very expensive procedure, but it's becoming more available. I'm very interested in preventative diagnostics.
mhm,
So, full body MRI, Gallery, sort of liquid cancer screening. Is it there yet? Maybe, maybe not. There's a lot of pre-test counseling that goes into that, but I think the more as preventative as we can, as technology advances, I think that's very exciting. Hyperbaric oxygen, red light therapy, all these modalities. Uh, I'm excited to have
mhm.
access so I can use them all the time, and for the right person, kind of
Yeah.
slowly implementing them. And as they become more widespread, the cost should drop. So those are some of the things I'm watching.
Okay. Okay. Yeah. Yeah. Hopefully, we can get to that point.
Yeah.
Um, so everyone, you can mention in the comment if you have any question, how people can find you, Dr. Philip.
Yeah, great. So at D5 Health on Instagram or Dr. Deibel, Dr.
Yep.
Deibel, and the website's d5health.com if anyone
Mhm.
has interest there.
Thank you so much. Thank you. Have a great day.
Thank you. Thanks for having me. You as well.
Bye.
Bye.